The Health, Human, and Social Services Committee to order. We're way behind schedule, so I'd appreciate it. Congratulations.
Adjourn it till tomorrow, then.
Pardon me. I got a busy day tomorrow.
Thank you. Thank you. Yeah.
Okay. That was my other...
I think so. We're going to do that discussion in a second.
Okay, first thing on the agenda, I would like a motion to approve last month's meeting minutes.
No problem.
Supervisor McDevitt, Supervisor, Mayor.
We have to-
Any additions or corrections to the minutes? Okay, all those in favor?
Aye.
Opposed? Carried. Okay, with that, Chris?
Sir.
I've been passing out the handouts. I just had two items this morning. The first one is you request an amendment to the county budget to add grant funding. This is our annual allocation of Workforce Investment and Opportunity Act funding. Typically, this is done in May. We didn't get our allocation amounts until late this year, but this is our the bulk of our funding for the course of the year, and you see the total of $587,000. This is just about $2,000 exactly less than we received last year, but it's about $5,000 more than what we had actually expected from the preliminary estimate. So we're pretty happy with the amount.
I bet you are.
Yeah.
Okay, someone like to entertain Supervisor Leggett, second by Supervisor McDevitt. All those in favor?
Aye.
Opposed? Carried.
And then the only other item I had was the request to host a meeting for the Summer Youth Award Ceremony and Picnic. This year it's scheduled for Friday, August 17th. And as I mentioned last month, I realize that's the same day as a board meeting, but we're hoping that if you can come a few minutes late, that's fine.
Right, and I had mentioned that at our board meeting on Friday, that it might be nice if, when we finished with our board meeting, that as many people as could maybe make an effort to run down for a few minutes, so.
We have the President and CEO of the YMCA as the guest speaker this year.
Oh,
They've
good.
been a great partner. Every year they take 5 or 6 kids anyway. One of their permanent employees was a former summer youth way back when.
Chris, what time would this start?
It starts at noon.
Noon.
Yep.
All right, someone like to make that motion to host the meeting? Supervisor Leggett, second by Supervisor Bramer. Any discussion?
Maybe we should have a ban for the supervisors.
Have a what?
Have a ban.
Oh.
There you go.
Waiting.
Make sure we get you down there, right? All right, all those in favor?
Aye.
Opposed? Carried.
And just while we're talking about youth, we have 51 on the payroll as of this pay period, which is up a few from last year, so we're real happy with that.
Okay, very good. Is that it?
That's it.
That was fast. Thank you, and I'm
Thank
sorry
you.
that we held you up.
Oh, it's okay.
All right, have a good day now.
You too.
I like the way you had the lunch meeting.
Yeah. Well, why was that?
I like the way you run the meeting.
Oh.
Great. Go girl.
They're great. Try.
Stranger?
Yeah.
Look at this there.
Yeah.
Wow.
Well, I haven't missed that many meetings. No, you haven't. Good morning.
For a while, yeah.
I'm alive, let's put it that way.
Make a comment, but I thought that was not good.
Anytime you need the team to come up, you just call the A team.
Yeah.
Some enforcers up there, huh?
Chris, before you go, good day.
Thank you.
Thanks, Julie.
I think it's different than what we sent out on the email, it would basically be all the same. Oh, okay.
Yeah, just a late breaker yesterday.
Oh, okay.
It's kind of like the Tum Tabs there, you know, that's a... I can't take that. A quick reference?
Okay, Chris, it's all yours.
Morning, everyone.
Good morning.
Have a couple of items that like to request here. As most of you know, our Deputy Commissioner, Chief Legal Counsel, had resigned effective June 1st. So we're looking to do something with that position. My first request is to create the position of Deputy Commissioner and delete the position of Deputy Commissioner, Chief Legal Counsel, and to fill that vacant spot with a new person.
All right, would someone like to make that motion? Supervisor Gowan, seconded by
Second.
Supervisor Leggett. Any discussion?
Yes.
Yes, Mr. Leggett.
So, this is a whole new position. This is not tacked on to an existing position like previously. Exactly. We're going to eliminate this one position of Deputy Commissioner, Chief Legal Counsel, and go back to a similar format that we had in the past with a Deputy Commissioner who does not have any responsibility for legal work. But fulfills all. Exactly. They can focus on things within the department in the program areas. Okay.
Supervisor Bramer, you had a question?
Thank you. Can you just give us your whole plan? I saw in the packet, and I appreciate the breakdown of the cost for the whole, your whole new plan. Can you just go over that for us?
Yeah, we, one of the things that we've been discussing is our organizational chart and how things are laid out over at DSS, and we've been making some improvements within the various areas, not only physically but structurally from a workflow perspective as well. And we really need to have someone who is in an administrative position on the second floor for the program areas that are regarding eligibility. There's been kind of a lack of supervision there at a certain level in regards to these programs. In the past, we had directors of eligibility, and we've also had a deputy commissioner of eligibility. Those positions had gone away over the last few years. In what was created was the deputy commissioner, chief legal counsel position a couple years back. So during that period of time, neither the commissioner or the deputy commissioner really focused too much on those areas, and we really found that there's a need for someone to be there and physically on the second floor. I think it will help improve the workflow, it will improve morale, and it will be a very supportive person to not only myself but to the workers on that floor. I had a discussion about this with the whole group last week, and people seem to be really happy about the fact that we're going to have an administrator now in that area. So that's part of that. The other piece of it is we do have legal work that the chief legal was doing that does need to still be done. So we are asking to create as part of this, a part-time assistant attorney. One of the things that we have found is there are certain areas where we're going to have more legal work, and there's also certain areas that needed to really be tended to that weren't getting as much attention as they needed to get. One of those areas was resources, where we go out to find funds to reimburse various programs that clients might have assets that are available that we can recoup some of our costs on. There's not been a lot of legal work in that area as it should really be done, so we need to pay a little bit more attention to that. Also in the area of child support, in the child support collections unit, the family court judges and magistrate really want legal to be more involved with that work. So we definitely need someone. We don't need a full-time, but we need someone to take up some of this work. In addition to that, we have Raise the Age, which is going to create quite a bit more work within our department. We already took on quite a bit of legal work over the last couple years in regards to children who were adjudicated juvenile delinquents or persons in need of supervision. We don't do the prosecution, but we do all the legal work after that. So if a child comes into care and we need to go back to court because they need to stay in for whatever reasons, we handle all that legal work within the department now. Whereas a few years ago we had a part-time attorney at the county who handled some of that. So basically what we're looking to do is make sure that we get this work done in these coverage areas that really need attention.
I don't think you're satisfied yet.
Thank you, Chairwoman.
Okay.
Not that I'm not satisfied, I do have a follow-up question. Well, one of them is how many attorneys do you have there now?
We have two.
There's two.
Yeah.
And can I just ask the county attorney how that interfaces with the attorneys in her office, or herself, and...
Go ahead.
I just want to clarify on the PINs and JDs. We do the prosecution and we do the entire process unless they are placed. If they are placed, we do that prosecution as well. After a year in placement, if DSS decides to continue the placement, they will do the continuation.
Exactly.
So that's the only thing that they do regarding JDs and PINs. But like I said, our office does all the prosecution of the PINs and JDs.
So this additional part-time attorney is not really taking work that your office is doing?
I mean, not in my opinion.
Well, we did have a part-time attorney before, so apparently they kept her busy part-time, so I don't think having another part-time is going to be taking away from anybody. I'm assuming it's just kind of maybe helping you out in some way.
Yeah, and there is actually more legal work that's involved with PINs and JDs than just filing petitions for extension of placements. Once they come in, we do all the legal work. The county attorney does the prosecution. Once they're placed in our care and custody, we have to do all the legal work from that point on. The county attorney's office is not involved again, usually unless there's some kind of a strange circumstance that we need them to be involved in. So if a child is placed with DSS who is PINS or JD and they get in additional trouble or they go AWOL, which is common, our attorneys have to take care of all that work with the family court. If they get arrested in another county, our attorneys take care of the other work with that as well.
I think Chris and I need to have a conversation because we actually do that too, so maybe we should figure out.
Yeah, that hasn't been my experience.
Okay,
I
so
just
we'll
want to
leave it.
clarify, I have no opinion on this part-time position. Their attorneys are extremely busy. I'm sure this attorney would help them immensely. I think we need to get on the same page about the JDs and PINs.
Okay, that makes sense for you two to handle that. Supervisor Bramer, any more?
I'm satisfied, thank you.
Thank you. All right, all those in favor? Nope.
Just one logistics, so part-time position, how's that to be filled?
We will advertise for that position and try to get a part-time attorney who can possibly work 30 hours a week, up to 30 hours a week, handling the cases. Primarily, I think what they will handle will be cases within child services, because I want to have full-time attorneys who are going to be working on other things as well. Okay.
I'd also add for anybody who was here yesterday at the criminal justice meeting when Mr. Yusi discussed the reimbursement process for Raise the Age, that we are working actively with both DSS and the county attorney's office to identify what functions in their office may be eligible for full reimbursement. We will be including those in our Raise the Age plan and submitting it to the state to hopefully recover more of these costs.
All right, any other questions? All right, what we're voting on right now is to create the position of deputy commissioner and delete the position of deputy commissioner. We've been discussing the part-time attorney, but that's in the next request, so we're acting on this particular one. So all those in favor?
Aye.
Aye. Opposed? Carried. Now, Chris will go on to the next one there.
Okay, the next One is to create that position of part-time assistant social services attorney, and the intent to fill the position of deputy commissioner and to fill the part-time assistant social services attorney position.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Bramer. Any discussion? All right, all those in favor? Aye. Opposed? Carried. All right, next one, Chris.
Thank you. Number 2 here for request resolutions is to request to amend the county budget to increase revenues and appropriations in the amount of $50,000 to reflect a supplemental nutrition assistance program, also known as SNAP. These are award monies that are specifically allocated to enhance efficiencies within the SNAP unit. They're money that it's funding that would come from the state and the federal government in regards to buying equipment and trainings to increase our efficiencies in those units. And the nice thing is that it is 100% reimbursed. Julie has worked very hard on figuring out what items we would need, and she also made sure that they were items that would be useful for these programs, and also I believe it's going to help improve some morale because a lot of people are going to get some new equipment. So it's really a nice thing that, a nice program that I was completely unaware of. I found out through an email, and then Julie jumped right on and we met and went over things, and she met with some other staff, found out what people needed, and you know, it's really a nice thing. So we're not spending any money out of Warren County money.
Right.
We're getting this through grants. So.
Good. Nice job, Julie. All right, someone like to make a motion to approve that? Supervisor McDevitt, seconded by Supervisor McGowan. All those in favor? Aye. Opposed? Thank you. Carried.
The next item is an item that we probably should have had at committee the last time. We just inadvertently left it out. It's requesting permission to authorize a 2018 agreement with the town of Queensbury to provide certain youth services for the Department of Social Services, the Youth Bureau, in the amount of $1,715.
Yeah.
All right, Supervisor Bramer, seconded by Supervisor McDevitt. Supervisor Garrity.
Yeah, I have a question about this. Is this the same as the recreation money that you approve for all the towns?
It's for their youth support program. They run a youth support.
Well, so don't we. If we don't get anything, we post for meetings and whatnot. I asked you a question last year, nobody can explain it to me why. And we contributed, the town of Warrensburg contributed towards making a donation. Is this because they hold the court in Queensbury? Because they hold meetings in Warrensburg also. And I think I asked last year, nobody could really tell me what this money is.
That's something that we can definitely look into.
Well, I mean, you know, I agree, let's be fair about it, but I think the only two communities that contribute to the youth court when we ask for donations was the town of Queensbury and the town of Warrensburg. I don't think any other, maybe they do, I may be mistaken. But we host meetings there, and I asked the question, why does Queensbury get $17.50 extra?
All right, you'll look into that then and get back to Mr. Garrity with an answer for that?
Supervisor Garrity, I'll be glad to look into that.
Yeah, I'd like to know.
And I'll get back to you as soon as I find out some more information. If it's something we can do, we'll work it in there. Okay? Absolutely.
All right, Supervisor Bramer, comment?
Sorry, my comment is that the resolution from 2017 refers to an agreement, so perhaps if we can find the agreement, if there is such a written thing, that might
I'm sure there's something.
what that money is for, and maybe we could come up with an agreement with town of Warrensburg.
Yeah.
Julie, this is
Similar stuff that you're doing, then we could certainly try to fix that into it.
But I asked last year.
We did.
I didn't realize that when I looked into it, that's what I told them with only towns that have their own youth court.
Their own youth court. We
Right.
sponsor meetings for all of them. I mean, I don't know if you're aware of it, but she uses ours probably.
We'll definitely look into that.
All right, they'll look into that then. In the meantime, we need to vote on this. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Rick?
All right, the last item we have is to request a transfer of funds. We had a motor vehicle accident at DSS a while back, and the vehicle was actually totaled. Fortunately, nobody was hurt. But we were doing some research as to how we could replace that vehicle, and Julie had found out through our purchasing agent that there were actually funds that were available for a vehicle to be purchased for public health, but they decided they were not going to purchase that vehicle. And they worked together to arrange it so that DSS could perhaps purchase that vehicle to replace the vehicle that we had that was totaled. So it's a request to increase revenues and appropriations in the amount of $16,341 to purchase that vehicle for social services, as one of our vehicles was taken out of service due to being totaled in
All right,
an
someone like to
accident.
make that motion? Okay, it's an appropriation, right, not a transfer, all right? Would someone like to make that motion?
This is appropriation out of...
The vehicle reserve.
The vehicle reserve, $16,341.
That motion.
All right, seconded by Supervisor Bramer. Any discussion on it, Supervisor Bramer?
Thanks. I would just ask that, I know the DSS people do a lot of driving around the county, so if you could consider purchasing a hybrid. The county fleet has been getting updated slowly with some hybrids, so please take that into consideration, if you will.
Supervisor Leggett for
Was there
that.
any insurance recovery on that accident?
No.
Because
Value of the car was after a certain value, self-insurance automatically drops. It was 2011, so the value now for the cost of the claim.
Right. Any other discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
All right, I guess the only other thing I have is to give a little information about some things that have been going on over at DSS.
Okay.
On June 22nd, I met with Personnel Officer Trish Neninger in regards to adjusting a number of positions and various other topics. Basically, she was educating me on the nuances of civil service rules and laws. She's been super helpful with a lot of different situations, and she's a wealth of knowledge in that area. So that was nice to meet with her and discuss those specific things. On June 25th, we had an independent living meeting at DSS for children in foster care, and they had requested to meet with the commissioner about some certain issues and to address some certain concerns. So I met with them. It was really nice. I had met a couple of them before, so one of them had actually just taken advantage of a new program that is out through the state, and showed me his new motorcycle, which he gets to do his job on, so it was kind of neat. We also wanted to start having regular legal unit meetings with the various units within the building that utilize our attorneys. We hadn't had those kind of meetings in quite some time, so we started having those meetings on the 28th of June. We had a meeting with Children's Services and legal staff to case conference on some specific issues and procedures. We also met in regards to our APS CASA unit and the child support unit, trying to assess their legal needs. And these are some of the meetings that took place over the last, here and there. in regards to trying to formulate what we did need for attorneys and what kind of time they're putting into things and what are the expectations of others outside of the agency as well. So that's started again. We're having regular legal meetings within the units, which I think is really good to have because it keeps lines of communication open, and we're working in collaboration to improve the processes. On the 6th of July, I met with Jackie Figueroa and Nancy Ross to discuss a host of staffing topics. Once again, it was very productive, and they educated me on a lot of things, which was nice because I am a commissioner in training, so it's nice to learn a lot about how some things work behind the scenes to make sure that we're doing things appropriately and properly, and also addressing the concerns of the union as well, because our employees are union employees. On the 13th of July, I met with Edward up at Countryside, and we had quite a long meeting about a lot of different things. Thank you for having me up there again, Edward. It was interesting to talk about some specific issues and needs of Countryside, and we also discussed some marketing ideas. Last week, July 17th, or 16th through the 18th, I attended the New York Public Welfare Association's annual summer conference in Saratoga Springs. A number of employees from DSS also attended some workshops there, not the whole session, but a few of them. A couple of the ones that I attended were in regards to APS supervision and decision-making, in casework, staffing, morale, retention, and utilizing strengths in the workplace, and raise the age, training issues in regards to recruitment, leadership, and I went to a leadership and bias workshop, which was very interesting, and of course fiscal and budget concerns, which are always especially important, especially this time of year because we're going into that season. The other thing that I wanted to do was to meet with the entire Department of Social Services with all the employees. So last week we had a large group DSS meeting. We hadn't had one of those in a few years, and it was really good. I think it went well. We had a couple of laughs, and I had a couple faux pas that were, well, not to be mentioned, but it was fun, and it really it went well, and we discussed a few issues, and a lot of good things came out of that. On Friday, Supervisor McGowan was over to DSS, and we had a really good discussion about a lot of topics, and also had a really good conversation with Supervisor Bramer in regards to some issues. So it's been a productive few weeks again.
Yep, you've been kind of busy, that's
Thank
for
you all
sure.
very much.
Thank you, Chris.
Thank you.
Guess it's Julie now?
For the revenue and expenditure before, I don't know if you had a chance to look at it, but I still don't have any concerns. Revenue is down a little bit, but it comes in more in the second half of the year than in the first.
Okay.
So at this point, I don't have any concerns.
Okay.
Our overtime has gone down a little steadily, so hopefully we can hold it there. Claudia, I just, on the car thing,
Yeah.
the specs that I got did have Ford Fusion hybrid. The difference in cost, the car that we're purchasing now is 63. The Fusion hybrid was 23. And some change. Now, we're slated for 3 new cars in 2019. So if we went, if we asked for hybrids, we're looking at, 23, like $60,000 more.
You
Give or
have to
take.
ask Julie. Those are the specs that she gave you?
Yeah,
Okay.
she just gave them.
Okay, that sounds
So
like,
it's a
yeah,
fairly recent
that's a
quote.
pretty big difference.
Yeah, especially when we have 3 cars, we're on that 10-year replacement, and we had 3 2009.
Do your cars get purchased through the fleet bid?
Yes.
Okay. Because I feel like that number was not as big for the ones that we bought for Frank's department directly. I'll ask Julie and Frank about that, see if there's anything
We
else.
would love to go hybrid, I'm just not sure.
We did pay a little bit more, but it wasn't that much more. Yeah.
Well,
And the health department, they're up for, I know this is not.
Okay, yeah, we won't worry
We
about
can
that.
talk offline.
Right. Okay, so,
Thank you though for your interest.
anything else on that, Julie?
nope, that's good.
All right, thank you, and Edward is next.
Thank you.
Oh, thank you.
Hey, good morning.
Good morning.
I do not have any action items, but I did enclose the updated census report and the overtime report. Look at that. If you have any questions or comments?
Anyone have any questions? So we're at 32 presently, Edward, as a census, right?
As of the end of June.
Okay, oh, okay, the
That's
end of
right.
June, all right.
Excuse me, Edward, what is
Yeah, go ahead.
the maximum capacity?
48.
48.
48.
Edward is working hard to try to get those numbers up, but it's not an easy job. Supervisor Bramer?
Thanks. Now, I know you have the overtime through July 8th, but how is it looking since then?
Well, the last pay period was the 22nd, which is the other day, and I believe we had, that week, I think we had like, it was under 20. I think we had like 15 or 18 hours of overtime. And most of that, the majority of that was due to a physical plant emergency that we had, which always, never occurs between Monday through Friday 8 to 4. It's always off hours. So we did have a physical plant emergency on a Thursday, I believe it was the 12th, like 8 o'clock at night, and we did have to call in a number of our staff to handle that. So that was the reason for that overtime for the pay period ending 7/22.
All right, thank you. Any other questions? All right, Edward, I see here you under information for discussion, although I don't see it on the other one. On one I have increasing private room rates. Is that just on hold for now, or is that something you wanted to bring up?
Yeah, that's probably something we probably will table for the next meeting.
Okay,
We gave that a little more thought, and we need to do a little bit more research on that to be a little better prepared, so we'll probably discuss that in August.
okay, that'll be fine. Anyone else have any questions from the committee? No, then I guess we're all set with social services. Thank you, Chris, Julie, and Edward.
Thank you so much.
You're doing a great job over there.
Thank you, I appreciate it. I've got a lot of help.
Yes, you do. That's good. Yep.
Can you explain this white space?
Is internet using the old TV white space?
They all here?
Waves?
Yeah.
You know where you
We're running so far.
in the air? It isn't a big deal.
Oh, okay.
It's 30 bucks.
Morning, how are you?
Yeah, well, we have to maintain it. They got a grant back several years ago. We have contract with Frontier to tie into their fiber line, which is the big buses and special tax. We have
All right.
some revenue.
Thank you.
And that just does work but because we're not maintaining it right now, which we were last year, we got things up and running, we were maintaining it, we had some problems, we fixed it, things are going well.
Wayne's next to you?
Yeah.
So we both rent and
Over there too?
It's like it, yeah.
put a lot of nasty things about the guy that was doing the work, and so nobody maintained it. It's a long story, but
I've been following it.
it's very,
They worked it out?
Yeah.
Good.
but it's gonna turn out much harder than you want.
Good, good.
I believe there's some things on the horizon that are gonna be good.
Right.
Have you been golfing or boating? You're all
Mowing.
Around the house.
working
He
outside?
mows.
Around the house.
Well, you're just as tan as can be.
I know, isn't he?
Yes.
And he works without his shirt on, too. you know
I'm
what I mean?
thinking, what you been doing?
Doing like two times.
He's got a golf course yard.
Oh.
I wish.
Okay, Janelle, we're all set.
All right, good morning, everybody.
Good morning.
The first thing I'd like to ask is to request a resolution to award a bid and an authorizing agreement with Durin to provide transportation for preschool and early intervention. And I cited the Warren County bid number. Basically, we had a bid agreement with Durin Transportation for preschool children with disabilities and early intervention program in Warren County, pursuant to the terms and provisions of the specifications of the bid and proposal, and the rate came in $54.40 per child per day, or $200 per child if we're requiring a bus with a wheelchair lift. And we're looking for a term to commence September 1st, which is the beginning of the next school year, and terminating August 31st, which can be extended annually under the same terms.
All right, would someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Diamond. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
The second resolution request is to amend an agreement with Delta Health Technologies, LLC, for mitigation of patient data from Encore to Crescendo, to authorize a site optimization visit not to exceed $8,000. Tammy, do you want to elaborate?
Sure. In that we actually the transition from Encore to Crescendo is going very well. I know when it's changed and it's different for everybody, but our clinicians are doing a really, really good job. Our nursing staff and our supervisors have been doing a great job. We've now been up and live for about a month. So what they've offered, and they've done this for us before when we went to their Encore product, is they'll come back in a few months and they just take a look at our processes, because inevitably when you're first learning something, you're going to be able to find a way to do it, not necessarily the most efficient, the best way to do it. So that's what this covers. And we're going to use DSRIP monies. We've received over $100,000. Our department for DSRIP funding has to be very, very specific uses for DSRIP type activities. The migration of our health record from our current product to the new product was necessary in order for us to be able to submit data to a regional health organization. So we can use this money for this. We couldn't buy a copy or things like that. But it'll fit under this, and it's well covered under any of the monies that we've received from DSRIP thus far.
All right, thank you. Would someone like to make that motion? Supervisor McGowan, seconded by Supervisor McDevitt. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
All right, we'd like to request a resolution to amend our current contract with Emily Rustin, one of our occupational therapists, to provide education sessions for therapists, parents, and other individuals with our children involved in the EI and preschool programs at a rate of $250 per session for a term to commence actually August 1st, and with termination upon 30 days notice. We currently have these type contracts with a speech therapist and a physical therapist, this would allow us to have an occupational therapist. And these are programs that we offer through our Children with Special Health Care Needs grant. So the services would be funded through that grant and not at a cost to the county.
Are these one-on-one that the therapists meet with, like just one child, or they...
No, we offer a program to teach parents a little bit about growth and development, or things that they can do to enhance growth and development with their children if they're thinking that there might be delays. So this would be like a program that we offer for the community, and we usually offer it at Crandall Library. We've entertained looking up north, but you know, we're not getting a lot of people up north, so we try to advertise it down here, and then we could offer consultation for people up there. But you know, it's worked well with our physical therapist and our speech therapist, but this year we're wanting to tweak the program a little to include occupational therapy.
Okay, sounds good. Would someone like to make that motion? I think they're all tired today. Supervisor McGowan, seconded by Supervisor McDevitt. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
All right, I'd like to seek a request for resolution to accept our 2017 annual report. Annually, we do an annual report that's prepared. We use it for a variety of purposes to report out as we're doing grant applications and things like that, and other people in the community sometimes are interested in what our numbers are for our different programs. So we ask resolution every year. We're a little late this year, but we finally got it together, so we're asking for resolution.
All right, and you did email out a copy of this to the committee, right? So if you feel so inclined, run it off and read it. Believe it or not, I did sit at my desk yesterday and I read through the whole thing. So.
And what did you think?
Well, fewer babies were born and more people died. That was a one thing that stood out as I read it. It was kind of interesting, and you're always aware of all the programs that they're involved in. That's what I found. All right, would someone like to make that motion to accept the annual report? Supervisor Hyde, seconded by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried.
All right, the next resolution request is for a budget amendment. If you want to refer to attachment number 6, Tom Driscoll, our fiscal manager, can explain.
We happened to get a check this week, or last week actually, for more district funds for $10,349.51. So I'm just amending the budget by that amount, and it's all the revenues right now for the district funds are going into a deferred revenue. And as we spend it, and I'll be doing a big journal entry because we're probably close to over $50,000 right now, and I'll be moving that money from revenue, deferred revenue, to our books, so you can see that revenue. So that'll help our bottom line. Because the expenses have been there, but Treasurer's Office, I spoke as to how they want that, and as it's been paid, they can move the money. So I just have to do a journal entry to do that. So this is putting in additional funds. We just got another check. So that was good.
Good for you. All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor Bramer. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
All right, for pending items, we didn't have any for this month, so we're on to information for discussion and review. Our emergency response and preparedness activities are on attachment 1, and Ton is going to review our report of revenues and expenditures and our comparison report on attachments 2 and 3.
Attachment 2 are our current fiscal status, and we, like I said, will be moving eventually $50,000 at least over into our revenues, and I did accrue for this month in our numbers. You'll see that we closed the month of May at over $346,000. We had an early intervention grant for the quarter of $66,758, and our WIC revenue of $27,378 is now all included. Also, we did the preschool program is the big program I tell you about every year that we have to wait until they bill us, so then we can fill out the paperwork. So our second bill that we got that we can now bill the state for was for $385,408, and we've added that to our revenues to better reflect where we are currently. Regarding salaries, again, we are at 44.68% of the budget compared to last year at this time. We were at 52.5%, being that we're into July. You know, you would normally think half, but that's good. We're under budget a little bit when it comes to salaries.
We are over in the regular salaries compared to last year, and that's basically primarily due to all the contract increases that usually happen in January. Our overtime and our part-time expenses right now are a little under compared to last year, which is good, and again, we utilize as much per diem that we can when we can. And then on attachment number 3, which is our comparison from last year to this year at this time, just gives you a rough idea. One of our biggest variances is in our expenses that we paid. Again, I did look into that, and it is just due to timing with our preschool program, off probably a month or a month and a half of some expenses that just aren't reflected yet. We're in a payroll or a pay week this week, so those will be caught up eventually by year end. And also to know our revenues are up a little bit over last year. One thing I wanted to bring to everyone's attention is we had an insurance company that over the last 4 years is supposed to pay us at a certain rate, a Medicaid rate that's been approved, because they're doing managed Medicaid, and they weren't doing this. They were paying us less. And I have my billing person's been fighting with them. We've worked with Mary and trying to get that. That's finally been resolved, and from 2014 to 2017, we got a check for over $94,000 that we were able to apply as revenue for this year. So that's good. We were able to do that. Now we just got them to correct 2018 rates. We're working on that right now, but at least they finally did do all that retro back billing. We thank Mary for helping us with that.
Very good. That's great.
All right, on to status of referrals, if you want to refer to attachment 4, and Tammy will give you the good news there.
Well, June was a really, really busy month for health services. Not only did we go live with our new computer system, but our referrals were up 25%. And that's going to be natural. You know, as soon as you get, it couldn't be our census was down just a little bit so that we could train people and be very calm and do it in a calm and orderly way. But you know what? You got through it. So it all worked out very well, and our referrals are up, and you could definitely feel it. It's been one of the highest referral numbers that we've had. Actually, we had one earlier in January, which is typical in the winter. We're going to see a lot of pneumonias and things like that in the hospital that are coming out. But basically, it was the beginning of last year when we were seeing these kinds of numbers. So seems to be holding pretty steady for July. As goes Glens Falls Hospital, we kind of follow suit. So as their census is up, typically our census will be up as they discharge patients. But it's a very good thing that we have per diem staff, because you're able to bring them in when you need them, you're able to not bring them in when you don't need them, and be a little bit more, apply more of a business model in health care, I guess is the best way to look at it, versus having all full-time staff so that you just have them, and as business ebbs and flows, you have the staff you have. So they have been a godsend, and they seem to be very happy coming in per diem, and it's wonderful to have them. So that's where we are with referrals.
Thank you, Tammy.
And our rabies program quarterly report is attachment 5. And for program updates, our early intervention survey, IPRO was here May 30th. We did receive our written report. Overall, our agency did very well. None of the findings impacted the quality of service that we provide to our families. A corrective action plan was submitted on the 13th of July, mostly addressing minor changes to procedure. With the quality assurance plan, we'll be looking to hire 2 per diem therapists, 1 for each discipline, to perform annual therapist evaluations. Currently, this is done with our contract therapies, but the state wishes that we have per diem employed therapists versus contract. And some counties are doing this with a minimum of 8 hours a year, but still the state wants to see a per diem status versus a contract status. So we'll be working on that as soon as our corrective action plan is approved. We don't want to put in the effort if it's not going to be approved, so we want to kind of wait and get a feel for that. Currently, this is done with our contract therapist, like I said. Our department will work with civil service to implement the plan. The early intervention staff really does a really great job. I think I put excellent in here. They do an excellent job providing services to our families. Our early intervention team did a wonderful job preparing for the survey, and Eric Mastriani is our senior service coordinator, and he actually did all the work with the corrective action plan, and he did an amazing job with that and has a very good understanding of our program. So I'd like to thank him for his efforts. Also, we had a state visit from WIC. State WIC representatives were here on July 10th. The representatives were pleased with the site visit that they did. The WIC staff has done a great job, and we recently didn't have a WIC coordinator, and so they really stepped up to the plate, did a great job. We were able to pass the state survey, and we now have a new coordinator in place, and things are going very well. So thank you for your support with that. As far as nursing positions, we've had people out on disability and workman's comp. They're both back, so we have nobody out on leave right now. And we do have open positions, so we are in continuous recruitment for those positions, especially in anticipation of retirement and things like that. So we don't want to turn down help if we can get it. And certainly with our increase of referrals, we did a great job with per diem, but I think it would be nice if we could at least get another nurse on board so that we could be training. For intent to fill forms, we have a part-time emergency preparedness liaison position that became vacant at the end of February. The position is fully funded by the emergency preparedness grant, so for informational items, we are submitting that. In addition, we have a full-time registered professional nurse position, RPN 37. The position became vacant this past week due to a promotion, so this position is reimbursable based on the caseload the patient has and the insurances that cover the visit.
All right, so we need a motion then to fill those two positions. So if someone would like to make that motion? Supervisor McGowan, second by Supervisor Leggett. Any discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
Thank you.
Mm-hmm.
Just for other discussion, Warren County is being looked at as a cancer study by the State Health Department. New York State Department of Health was here on the 19th of July to meet with elected officials, stakeholders in the community to discuss this cancer study. I did attach on attachment number 7 the handout that was provided at the meeting. There's a website on that handout that will click you to the presentation if you were unable to be there and you're interested in looking at that. I want to give a special thank you to Janelle Oxford and Dan Durkee for gathering our county's data to be prepared for those meetings in the event that there were questions asked about our county-specific data. And for their insistence in inviting stakeholders. I think we invited over 40 stakeholders to that meeting. The state was pleasantly surprised and had to move their venue a little bit to accommodate for some extra seating. Thank you to the elected officials that showed up, Supervisor Frazier and Bramer. People I might be missing, Mr. Driscoll. And then we did have an active community group that came and kind of voiced their opinions. I think one of the sad things is when you look kind of from a community perspective, they've had personal experience with cancer, and I think their thought of what the study was is going to be a little different from what the state thought was on how this is going to kind of go down. But I think the state's looking at data that they've got through the cancer registry, and they're basically going to be formulating a study based on trying to drill down some of that data. And I think the public's looking at, well, why does my grandmother have this cancer, or why do I have this cancer, and why do I live here near this or that or whatever. So, you know, the state was very attentive to their concerns at the meeting and was very patient in letting people speak, as many that wanted to speak. But we did have a lot of nice citizens that participated in that. And then finally, as you've probably heard, Tammy has accepted the Assistant County Administrator position, and she'll be working with the County Administrator. And we wish to congratulate her on this new position and thank her for her contribution to our agency. She's been a very valuable team member. During this transition, our administrative team is going to evaluate our department's needs to kind of see how we should proceed to cover the roles that Tammy had while she was at our agency. And although we're going to miss Tammy, she's not going far, and we look forward to continuing to work with her in her new capacity.
Very good.
Thank you.
We're happy for you, Tammy.
Thank you.
I guess that's it?
Yeah, we're good.
Supervisor Garrity.
I'd just like to thank the health and Dan Durkee for teaching CPR to all our counselors in Warrensburg. He did a remarkable job. He ran 2 classes and 2 or 3, and he does it every year for us. Dan does a great job. Appreciate that.
Well, I think the whole department does a wonderful job from what I see, and we really do appreciate all the hard work that we get from them. Is there anyone from the committee that has any questions? Anyone out in the audience have a question? All right, if not, then I'm going to entertain a motion to adjourn. Supervisor McDevitt, seconded by Supervisor McGowan. All those in favor? Aye. Opposed? Carried. Thank you.